Welcome to the Weigh In Podcast, your prescription for a healthier life, where wellness is more than just a number on a scale. We'll dive deep into not just weight loss, but the medical, emotional, and lifestyle aspects of well-being.
In each episode, we'll weigh in on hot topics ranging from diet myths and exercise trends to mental health and chronic disease management, providing you with the evidence-based advice to guide your health decisions. Remember, it's not just about the weight on the scale, but about creating a healthier, more balanced you.
Hey, Katie, how are you?
Good. How are you?
I'm doing great. My news piece for this week is probably something we've already all known, but I guess it's more official now. There's an article that I came across that said Mounjaro beats Ozempic in weight loss comparison. So if you're kind of used to the generic names, if you're used to the generic names, Tirzepatide is the generic version of Mounjaro, and then Semaglutide is the generic version of Ozempic. So there's actually been a official, study through, it was published in the JAMA Internal Medicine. So there was like a comparison of these two drugs. So basically they looked at weight changes after people that have been receiving the medication from like 3 months to 6 months to 12 months. So it showed that after 3 months, people that were taking the Tirzepatide lost on average 5.9% of their body weight versus the 3.6% compared to the ones taking Semaglutide. And then after 6 months, the Tirzepatide group lost on average 10.1% versus the 5.8% on Semaglutide. And then after a year, the average body weight loss was 15.3% with Tirzepatide versus 8.3% on Semaglutide.
Wow.
Yeah. And so it said here, those changes are equivalent to a 200-pound person losing just over 30 pounds after taking Tirzepatide for 1 year, or just losing over 16 pounds after taking Semaglutide in 1 year. So that's pretty significant. That's like a 15-pound weight loss between both. And so, overall, my clients, I think we've raved about Tirzepatide, back and forth. But as far as side effects go versus Semaglutide, they don't feel as many, little to none as far as nausea goes. And the weight loss has been pretty consistent. So, yeah.
Yeah, all of this tracks study-wise, although I will say this, it is a little surprising just how incredibly marked the difference is. You know what I mean? Like, we knew Tirzepatide was more effective, but to hear it quantified is like, wow.
Yeah. So, again, this is something we've already seen with our own clients, but to have an actual study done, I thought that was really interesting. But again, both medications are great. It's just dependent on your price point because they are, different. Semaglutide is usually priced cheaper than Tirzepatide. But again, that's because the reason why the significance is, like this is because Semaglutide targets one hormone receptor in the gut, whereas Tirzepatide targets 2 hormone receptors in the gut. So that's probably why it's stronger, as we already knew. And then again, in the works is is it Retroglutide? Is the one that targets 3 hormone receptors in the gut, so it's supposed to be even stronger than Tirzepatide.
I always forget the name of it because it's real name is something very complex. But but yeah, I mean, I think all of this is great news for Tirzepatide. Semaglutide, I mean, I just gonna say this because the numbers are a little bit wow when you think about the difference in effectiveness. But I do think that Semaglutide is still a very effective drug. That right now might be a little bit more affordable for some people. But I will just say this too, for that study to come out, did they come out this week?
At least this article came out this week. I don't know when the study was done, but it seems to be recent because first time I've heard about this. So
for this to come out in the setting of Eli Lilly dropping the more affordable Tirzepatide, it's a tough week to Novo Nordisk. That's, you know what I mean? That's this is right? Because now they're saying we're cheaper and we're better. Do you know what I mean?
Right. Yeah.
So yeah, that wow.
Yeah. So Novo Nordisk, I think they have to reconsider their CEO or their whoever's in charge. They're like, yo, we got to come up with another plan because we're looking bad.
They are, and these drug companies in general need to make these drugs more affordable for people. More affordable, but they have a bigger issue before they even address affordability. Like they need to address accessibility because right now, and nobody really seems to be delivering in terms of keeping up with the demand in terms of supply. So
yeah, definitely. So what's your news piece for the week?
Oh, mine is much less much less groundbreaking. But our girl Kourtney Kardashian Barker, you may know this or not know this, she has a supplement line called Lemmy. She's had it for like a little bit. I want to say like for a couple of years now. I don't know. It's supplements. And now she has one called Lemmy GLP-1. It's called Lemmy GLP-1 Daily. And it claims to be very effective and an all-natural way to manage weight. So I don't know if it's dropped just yet. It might be dropping like on the 16th of this month. So by the time that this podcast airs, it might have already come out yet. But it basically has a few ingredients. Here, let me just pull it up because my memory is not good enough. Oh yeah, so it has like lemon fruit extract, saffron, and Morcel red orange fruit extract. And according to the press release, it says it should boost the body's GLP-1 levels, reduce hunger, promote insulin sensitivity, and support healthy weight management.
And is it going to be offered at like a generic, vitamin place, or where is it going to be offered?
So it'll be sold via subscription model at $72 for a month's supplies or $90 as a one-time purchase.
And is that something you have to get through your doctor?
No, it's a supplement. So I think they can just order it from whatever the Lemmy website is. I'm not saying that you should order it, but if it interests you, then it's there. There are a lot of things that may claim to be like GLP-1s, but if you need a GLP-1, then you should just look into getting prescribed an actual GLP-1. In terms of supplements, this is a matter of preference, provider preference, and like sort of what you're into. I'm less so into supplements that I think can assist with my patient having more GLP-1, so to speak, when they're on semaglutide or one of those drugs, and more interested in supplements that can help with like their symptoms and side effects while on the GLP-1, and also help promote their gut health. So things like probiotics, for example, are more sort of my jam. So like, again, that's my preference. I don't know a ton on the research on some of these ingredients that she has in her supplement. The general consensus is I don't think that these all do a ton as far as significant weight loss. Red orange fruit extract does do a little something. People like who have done the Morcel red orange fruit extract in the past have lost I think like less than 5% of their body weight. So like it can help, and there may be other aspects of those other two ingredients that can help with weight loss, so it might be worth it for some people if they do their own research on it. I can't speak to how effective it is or isn't because I'm not even familiar with all of the ingredients because they're not things that I necessarily recommend to my patients, but what I will say is that the price tag for that supplement, at $70 to $90, I would just, if you're going to spend money on supplements, make sure that there are things that are going to truly, truly benefit you. So I would, it's never really take a supplement without consulting with a healthcare professional anyway. I would just be careful in general. But yeah, interesting to see what the response is. And yeah.
Right. Like semaglutide and Tirzepatide, those are probably the most natural medications that you can get because they are the synthetic version of the gut hormones that we make in our own bodies. So it's interesting that she's like trying to promote this as like a natural supplement Meanwhile, it's
Also,
like,
like, Google it. There's also like lots of foods that like support GLP-1. Like, just like there's certain high fiber foods that you can eat that can help. Like, I don't know that you need to put that money towards a supplement.
right. I feel like, yeah, like you said, if you're gonna want to lose weight, might as well just go for it and get yourself on a GLP-1 at that point. Because if you're trying to do things natural, like, then you could always, go back to tried and true diet and exercise, da da da. But of course, you probably tried that already. So yeah, I mean, it's
Or
cool that
there's other
everyone's
supplements that are a little bit that might give you like more effect. So I don't know. It's you know what it is, Zarina? I have a bias right now because the marketing of I feel as though the marketing of the supplement implies that it is somehow as effective as a GLP-1. Do you know what I mean?
yeah. Yeah.
And it simply isn't. So I think that's what my issue is. It's one thing to, just be like an effective weight loss supplement. But I feel like the way it's kind of marketed is, like take this instead of a GLP-1.
Right.
Which, I don't know that it should be used instead of a GLP-1. And I think that if you want help with supplements to help with weight loss, there are some that might be more useful than that one.
Yeah. And I feel like, if you don't want to do GLP-1s in general, I understand that. You could always do a B12 shot. You could always do a lipo skinny shot. Those are other options that we provide at both of our clinics just to help with that. I will say that, like, I don't find that the weight loss is as significant versus if you are on GLP-1. But if you have reservations of being on medication like that, then I totally get it. Yeah, we offer also B12 shots that are just more effective that we've found as far as like energy, and it does a lot more versus what supplements can do. Because again, supplements have to go through first pass and goes through your stomach. It's more effective if you get it like as an injection. Because we said the same thing too about the GLP-1s that are oral. We just find that it's not as effective. So yeah, I thought also the marketing is interesting. Like, I feel like everyone tries to make things like sound like Ozempic, like anything
Right.
that's close to Ozempic. Okay, but it gets in their head. All right, this is a weight loss med. So
I know, that's the thing. Yeah. So I mean, I just hope that people are always safe and careful when using any supplement. And again, even the best of supplements still have side effects and can have bad effects. So always consult with a health provider, because even the most benign supplements can have effects that you're not necessarily aware of. And always, when you're going to see a provider of any kind, if you're going to the ER, tell them what supplements you're on.
Yeah.
Because you'd be surprised, right? You could be on like a hair, skin, and nail supplement, and then we do a blood panel and your thyroid looks insane. Well, biotin does that. So like, it's always important to be super transparent about the things that you're on and what you're taking.
Yeah, absolutely.
Okay, so today we have Vanessa Gelin. She is an Ivy League graduate from the University of Pennsylvania and a board-certified psychiatric mental health nurse practitioner. She treats across the lifespan from children, adolescents, and adults with conditions including depression, anxiety, bipolar disorder, OCD, ADHD, and schizophrenia. In her free time, she enjoys going to Orange Theory, traveling, and hanging out with family and friends. And so just
Welcome
as
to
an
the
aside,
podcast.
welcome. I'm so excited to have Vanessa here. Zarina, I don't even know if you know this, but Vanessa is my friend, and we went to University of Pennsylvania together. And
Yeah.
and she is absolutely amazing. So it's so special to be able to have her on this podcast, giving us all the good information that I know that she's about to give us. But she's a lovely person inside and out, and a brilliant clinician.
Thank you, Zarina and Katie, for having me. I'm so excited to be talking about all great things on this podcast.
Yeah, we were very excited to have, especially a psych mental health nurse practitioner, because you're our first guest to be a psych NP. But there's so much that's involved with weight loss, and I think a lot of it is psychological. So I'd love to hear that aspect of it. But our first question is, can you tell us a little bit about your background and what led you to become a psychiatric nurse practitioner?
Yes, I've gotten this question many, many times. So initially, psychiatry was never my first passion. I really didn't want to go into psychiatry. Katie, you may know, I think initially I was in the family nurse practitioner program. I've didn't
And
start off as a
GFS.
psych nursing. I did like med surge, telemetry. I think I even did a little bit of ICU. And when I went to Penn, I was in the FNP program, switched midway, did a study abroad in India, which was health based, which I loved and didn't think I would love it so much. We were in the community. I got to go to people's homes. I saw acute care, like psychiatric care in the
Oh,
hospitals.
wow.
And I was like, wow, I really like this a lot. And then my mom, she's schizophrenic. And I think that really plays a big role
Wow.
in mental health because I realized I'm like, wait, I've been doing this way before nursing without even realizing it. And it's like, why am I not doing it? So yeah, I decided to switch into psychiatry, and there's definitely a need. And coming from a Caribbean background, I'm Haitian, um, and we don't eat cats and dogs, but
I
I
know.
was gonna mention a little joke about it, but you already did it. Just to clarify that, yeah, very important to know.
For the record.
I mean, at least I don't, but anywho, yeah, there's just a big stigma when it comes to mental health and taking care of your mental health and what mental health looks like. And I'm like, you know what? There's a big purpose behind this, and I think I should change, my career. And here I am now. So previously, I was working with kids, and I think that's where my passion is in like pediatric psychiatry because that's where mental health illnesses start usually in that teenage adolescent year. So I was doing that for 2 years. I did like acute care. So I was working in inpatient psychiatric hospitals. I was working in the emergency room, doing psychiatric consultations. And this was back in Atlanta, Georgia. Now I'm in West Palm Beach, Florida. So the population has changed a bit. There's a lot more geriatrics in West Palm Beach. You know, everyone wants to retire in Florida.
All the snowbirds, I'm sure too. Yeah.
That too.
Yeah.
So I do all populations now. I do pediatrics, adolescents, and adult and geriatric. So here I am.
Amazing,
Okay.
lots of experience.
Tons
everywhere.
of experience. So tell us, because Zarina remembers you. As soon as I said your name, she was like, "Oh, she's the one whose podcast you were on, the Resilience podcast." And I think that your podcast is so cool, which is why I was so excited when you let me invite myself to be on it, which I totally invited myself. I saw one of her episodes, and I was like, "I want to be on your podcast. It seems really cool." And so she brought me onto it. But I'm dying to know what inspires you to start the Find Your Resilience podcast.
Yes. So, I mean, I can't say a lot of people know me. A lot of people don't know me probably, but I am a very reserved, introverted girl. I'm not that bubbly, like all in your face. I'm quiet. So, I think expressing myself is always a challenge sometimes. And I really want people to get to know me. So I was like, oh, maybe I could do podcasting. That will allow people to get to know me. And pretty much the catalyst for the podcast was the passing of my father. So my dad died in 2020 from pancreatic cancer. So this was, I think, the beginning of like our last semester. Well,
Yeah,
for
we were
me, it was
still
my
in
last
school.
semester. Yeah. Um, and I was like, crap, this is like the wrong time for this crap to be happening. And then just say like from 2017 to 2020, there was just a lot of BS I was dealing with like family, like a lot of personal stuff. And I do mention this on my podcast. Like I remember like losing my job in 2017. I got fired, just to be straightforward, from HIPAA. And then I was in an FNP program at Georgetown. So before I even got to Penn, I was already in an online program. That ended up not working out because I needed, I think, like a 3.0 GPA. I was below that, and it was all online. And I realized I couldn't do
Not for
online.
you.
It was hard. So yeah, work and like just school wasn't working out. So I would say I mean, I don't like using this term, but I guess I was having like a midlife crisis. And I was just like, what is going on? Like, I just felt like things were just going wrong in all avenues of my life. And then there's just a lot of stuff with like family that I just needed to get away. So I was like, you know what? I want to start over. Um, so yeah, I end up relocating to Philadelphia. So I was just like, you know what? I'm just going to start school over. Online's not for me. So I guess I want to do like a brick and mortar school this time around and then find what I'm truly passionate in nursing because ICU was like the last gig I did, and I hated it. I don't think I'm an ICU girl. So I was like, you know what? I need to find who I am as a person and find what I like and enjoy. And I think that's what kind of led me into my podcast. And I just realized I'm like, wow, yeah, I've had many setbacks, but yet here I have all these comebacks as well from not giving up on myself. And I felt like I wanted to share my story. So I think that's where Find Your Resilience came from.
Oh my
Oh,
gosh,
that's
that just gave me chills.
amazing.
That's
Yeah, so
amazing.
touching. Love that.
It's tough. Life was lifing. Life is still lifing.
Yeah. Yeah.
That's still
Oh.
amazing though. To anybody else might have been like, you know what, I didn't do well at Georgetown. It wasn't for me. Maybe I just shouldn't do this. Maybe I suck. But instead you were like, you know what? I'm gonna just one up this whole thing and go to an Ivy League school, and go to University of Pennsylvania of all places, and slay it there, which is exactly what you did. So that's such an inspiration, and
Right.
you have totally picked the right track, Vanessa. Because when I met you and we were in that psych class, remember how they make the FMPs take psych, and I was like, ooh, the whole time I was you could tell who was FMP and who was psych, and I the whole time I was like. But she was all into it, and she was like, yeah, like, I'm in the psych program. I think you had just left the FNP program. Like, I used to be FNP, but I'm psych. And I was like, oh, your whole aura, that tracks. I'm going to sit next to you the whole class. And I sure did. I think the whole semester I sat
Thanks.
with you.
Thank you, Kate. That's sweet. But don't get me wrong. There were times where I felt like, I had the imposter syndrome. Like, am I good enough for Ivy League? Like, I just failed these classes. Who's going to accept me? So I definitely had those thoughts on the back of my head. My dad actually was really the driving force. He was just like, why don't you just apply again? And I'm just like, this stuff costs so much money. Like, apply again. He was like, you could do this. So he definitely did encourage me. So I think, having that support team too was helpful.
Yeah. And I truly think, things are meant for you at the right time. And
Mm-hmm.
I'm glad that you knew, because there's so many online programs now for NPs. And I also did, it's a hybrid though, but I did wish I had that brick and mortar experience, because I think it just helps to sit in a classroom and to really get to know your teachers and your classmates. So I think it's awesome that you guys did that. And then you guys, met each other and you created a friendship out of that. So that's
Yes.
great.
She was my
Yeah.
pathophysiology partner.
Yep.
Yeah.
Yep.
That's awesome. So, Vanessa, how do you see the connection between mental health and weight loss?
So I tell a lot of my clients this. There's a mind and body connection. So pretty much if our mind is not doing okay, you will see physical symptoms manifest, So like with weight loss, I could just say if you're depressed, your mind is not okay, you're going to have no motivation, you're going to have low energy. You're not going to want to get out of bed, you know? You're not going to want to create those positive habits. So yeah, there's definitely a mind and body connection. If your mind is not okay, you're going to see those physical ailments. If you have anxiety, you're going to have those stomach aches. You're going to be vomiting. I have a client who's like 16 who has like severe panic attacks, and it's to the point where she'll like physically vomit, and it's to the point where she's scared to eat. This is not really like a diet journey per se, but like the fact that it's affecting her appetite and she's afraid to eat, it affects, her appetite and even like, her weight as well. But like with weight loss, when I was working in the emergency department, I've had clients come in for concerns of anorexia or bulimia. They'll start off with getting their labs checked, and then you find that there's like an electrolyte imbalance, and now they're being admitted to the floor for a workup. And of course, they're going to consult psychiatry because, there's like a mental aspect to it. A lot are restricting their eating habits. They have this distorted thinking about eating. A lot of them have trauma, along with other things, depression, anxiety. There might be like a family history of eating disorder. And a lot of these teens, they feel like they're losing control in their life, and their eating is like the only thing that they can control. So they'll, go as far as excessive exercising, restricting their eating habits. A lot of them have a fear of wanting to gain weight. So it's really having that positive mindset and having the good support. And there's just a lot that goes into it. Same with bulimia. With them, it's more of like the excessive eating and the purging and stuff like that. And like we end up having to recommend, we also have to consult like dietitian, the medical team, consult psychiatry. There's like a whole team on board to assist with these type of clients because their journey doesn't end in the hospital. Now we have to refer them outpatient or even inpatient too, because they have like inpatient rehabs for like eating
Yes.
disorder patients. And it's a long journey. It's a long journey, and anorexia per se could be very fatal if it's not treated correctly. So yeah, it's a mind body connection, and we do have to medicate them. Um, with medicine. So like anxiety, we find that a lot of them have a lot of anxiety with meals, and they are on like a strict meal plan when they are admitted in the hospital. So having to stimulate their appetite is something they don't like, but it's something that we have to do for them. So like we'll start them on a medicine like Remeron, mirtazapine, it's a generic name for it.
Mm.
Some of them sometimes need like an antipsychotic like Zyprexa, and a lot of these medications do promote weight gain. You'll see a lot on like SSRI, so like antidepressants, to treat their anxiety and depression. But yeah, there's a lot involved, and there's like a mind body connection. So like if your mind's not doing well, you'll see it manifest in your body.
So I don't know, Vanessa, if you have had clients in the past who maybe aren't even seeing you for eating as one of their like chief complaints necessarily, but maybe they're seeing you for something different, and maybe they're seeing you for depression, for example, but maybe they also want to lose weight. For these people, right? Are there any sort of common like mental health challenges that you've seen in these types of patients? Like, have you noticed that, for example, like the patient that you have that wants to lose weight tends to be battling with something like severe anxiety or severe depression, compared to like, or do you feel like these patients are more likely to like already be on antipsychotics? Like, is there anything that you've noticed or any common themes that you've seen?
Well, for my clients do struggle with weight, because obviously when they see me, they're not seeing me for like weight loss medicine. They're seeing
Right,
me for like other
exactly.
stuff. So that's not really their concern. They'll probably see like their PCP or like a weight loss management provider for that. But I see that those who have a history of depression and anxiety tend to have more issues with weight gain, because of the lack of motivation, the lack of
Mm.
energy. And those are some symptoms that you see in the DSM-5 that, gives you that diagnosis for depression. So sometimes some medication will help, like Wellbutrin is a medication that could help with the dopamine. It kind of increases the dopamine and norepinephrine, and it could help them with their motivation and depression. So I find that when I start them on Wellbutrin, it'll help them with their motivation and energy to kind of help them along that journey. I have clients that are on like Monjaro and like Ozempic, that say it's a life changer for them, and the fact that they're on it and that the fact that it helped them lose weight increases their self-esteem. So that's an aspect too. Because I have clients that are not happy with their weight, but yet they're like, I don't have the motivation. I'm always tired. So I do recommend them to see like their PCP for lab work, just to rule out any organic medical conditions. Because I've had clients come back to me and tell me like, I had a vitamin D deficiency, and I'm like, yeah, that's a possibility. That's maybe why you're
Hmm.
always so tired.
Yeah.
Um, because I mean, you need energy to exercise. It takes a lot of effort. So, like, I always tell them, like, just check your hemoglobin, make sure you're not like anemic. I've had clients come back and tell me, I was anemic, now I'm on iron. Sometimes it's poor sleep hygiene, so it's really assessing and seeing what is it that I could do to kind of help them. Because it could be like stuff like that. That could help them, because you need to have
Hmm.
adequate sleep to help with your weight loss journey. You need the
Absolutely.
motivation. You need that drive. So I mean, there's different things I could assess for that could assist. And if I do need to make a referral for them to see their PCP or like a weight loss provider, I could do that.
Um, So emotional eating is a significant barrier for many people trying to lose weight. Like I know so many of my patients, they eat a lot because they're stressed or they're
Yep.
depressed, or they're bored. And so, like, what advice do you have for individuals that are struggling with this issue?
Yes, and I can even speak for myself. I am an emotional eater. When my dad passed, I probably gained like 20, 30 pounds. I must say in 2022.
Mm.
So I have a what do you call it? A smart scale? Is that what it's called? A smart
Hmm.
scale?
Yeah.
Yeah, so I was looking at the trend on my phone and I was like, man, in 2022, I gained like the most weight. Granted, my dad died in 2020, but I think it was like a buildup of like me with the poor like choices with food. But I noticed in 2022 I had the most weight gain. So I was like, what happened in 2022? And I found that I was really stressed around that time because I started a new position working in the emergency department. And I mean, there's studies and research that shows that providers that work in the emergency department are more prone to depression, more prone to anxiety, more prone
Absolutely.
to stress because you're working in a high paced environment. Um, and you're dealing with critical, patients. So it's definitely, I was just like kind of looking back, like, I may have been more stressed because I noticed I was ordering takeout more. Uber Eats is the devil.
Oh my gosh, yes.
It's too convenient.
I
So
mean, it's
convenient.
like you don't have to leave your house anymore to
No.
get food.
Yep.
You can easily get it delivered.
Yeah.
Yep.
You don't have to
Um,
talk to anybody. They just drop it off. So,
Ama-
Granted,
amazing.
I mean, you're paying maybe 20 extra dollars more in tips and like fees and stuff like that, but
Yep.
it's like you don't even care.
Yep.
So I find that I was eating takeout a lot more. Like I didn't want to cook as much. Um, so pretty much going back to your question, it's like you need the support. I feel like without
mhm.
support, it's so hard to be on that journey of weight loss. So I think around that time, I was like, man, I need a therapist because I'm like, this is getting out of hand. So I think I went and like found a therapist, made an appointment with a nutritionist as well to help me too. Um, but I think just having that support and having that mindset that it's okay, like we're all gonna have setbacks, but I think as long as you're, not giving up on yourself and knowing your
Yep.
why, like what's the purpose behind you wanting to be healthier, plays a big role.
Yeah, I definitely agree with you as far as like therapy goes. Because yeah, if it's you feeling sad about something, yeah, that should be addressed. And I think the comfort in food is where people are. It's just an
Mhm.
easy fix. It's right there. You feel bad. You kind of want to reward yourself in a sense, and that goes back to like the dopamine reward center and everything.
Mhm.
Yeah, so that's something that I try to tell my clients as well. Like, they're afraid to get off medication, specifically the weight loss medication, because they're like, what if I gain it all back? And like, yeah, if it's more so a psychological issue, I think that's something that should be addressed through a therapist. So I think that's a great thing that you mentioned, and I'm glad you did that for yourself.
Thanks. Yeah,
I'm
it's like
so
you're
glad.
yeah, it's like you're tired of being tired. So it's like, all right, something has to give.
Hmm.
Yep. I can so relate to what you said as somebody, as you know, most of my career was in emergency medicine. And I totally agree that, especially in the ER, because it's such a stressful environment, you are more prone to eating. I think hospital workers in general are just more prone to eating unhealthy. And I think it's twofold. I think you're right. I think it's a stressful environment, right? You're exhausted. And then I think also a lot of people in hospitals, not everyone, we're kind of like happily unhappy. So sort of like the vibe sometimes when you work in an ER is everybody's like, oh, I hate this, but they're also like happy to be doing the work, if that makes sense. It's like that ER
Yes.
attitude that you have. And as a result, because you have this sense of camaraderie, I feel like sometimes we all would collectively eat badly together, right? Like we would do things like 3 a.m., like, oh, like who's going to do a Wawa run? And I remember
Right.
there used to be this one guy who would get like a whole half gallon of like sweet iced tea at like 3 in the morning. You know what I mean? Like, and nobody else would say anything because I'd be like, I want cookies. Like everyone is stress eating together. And so my point with all of that is I think that, one aspect of sort of having an unhealthy lifestyle can sometimes be feeding off of the company that you're around, right? And
That is
obviously
true.
in a work setting, that's a little bit hard to avoid. You would have to make a conscious effort to avoid it, right? But it's almost like when you're in a setting where everybody's eating unhealthy, then you're more likely to enable each other. And then you feel like it's okay to make that unhealthy decision. So I think that the ER stress life is transferable to so many other situations, right? Whether you're stressed at work and you have a bunch of family members that eat unhealthy, or a bunch of friends who do like heavy drinking. A lot of times you have to take a step back and be like, who am I surrounding myself with? And are their habits somehow affecting the habits that I have?
Yes, I agree with you 100%, Katie. That's why they say you have to hang around people with those same goals and mindsets, because it will definitely set you up for success.
Yep. Vanessa, there's been a lot of talk about GLP-1s having negative effects on one's mental health. And I don't know if you've encountered this, because I don't think Zarina and I have seen it a ton. But there have been talk about sort of the effects that these GLP-1s can have on one's mental health, and also just sort of the general sort of like anhedonia or like disinterest that sometimes people will say they feel, right? Like people will be like, oh, I'm so happy that I'm not interested in food, but I'm also just not interested in things in general. Do you have any sort of like tools or tricks or suggestions for what people can do to overcome this? And do you have any thoughts or insight on sort of this whole GLP-1 and its impact on mental health at all?
Well, true transparency, I did start a GLP-1 for my weight loss journey. Because I
Getting
needed.
wedding ready. Love that.
Right.
Yes, I believe I started back in May, because I was just like, this. It's harder. I don't know. I'm in my 30s now, and weight loss is just not as easy as it was in my 20s.
Facts.
And I'm just like, I used to just like burn it quickly. This time around, it's like, it's harder. Plus, I have more responsibilities. It's like you have to maintain a home, and it's just a lot going on. So anhedonia, I have not seen that for me. One thing I must say, I've noticed it's made me a lot sleepier, but I think that's due to dehydration. Because I did mention this to like my provider, that I'm like, oh, I find that I'm sleeping a little bit more. And then I was like, am I more depressed? Because there are some research, I mean, not a lot, that says maybe it's correlation to depression. But I think the minute I started increasing my fluid intake, I noticed that I'm not as tired anymore. But I think when I first started, I was sleepy. I personally haven't seen anhedonia in like my clients that are on it. They actually seem more energetic. So I don't know. I haven't really seen too much.
I agree. And I think that's what Zarina and I have mostly seen, is that most of our clients feel great on it and feel amazing. But there have sort of like been out in the world things about, semaglutide or any of the other GLP-1s sort of causing some of these some of these things like depression. And I didn't know if you had seen it, because like I said, in practice, I really haven't seen it.
Yeah, I
What
haven't.
about you, Zarina?
I've seen the opposite. I had a client who was on an antidepressant, and she said that she was able to actually lower her dose of the antidepressant when she was taking the weight loss meds. As far as fatigue, yes, I have seen that with my clients.
It's a common side effect.
Yeah, I usually recommend to take, like, you could do B12 shots, or you could do oral B vitamins. I mean, if you're getting a compounded version, there's a little bit of B12 in there, but that could just give you a little boost if you have just a pure B12 shot. As far as like depression from GLP-1s, no, have not seen that among my clients. So that's a good thing. For the most part, they're happy because they're like losing the weight.
Yes, they're feeling good. And honestly, most of them are like, oh my God, this is amazing. For the first time, I don't have all the food noise that I've been plagued with for most of my life. To them, most people feel like so free that for them, it's like the opposite.
Yeah, I mean, I've lost a total of 20 pounds, and I am so happy. And I'm just like, I have not been at this weight in like the last 2 years. I'm still not at my goal yet, but it's just very exhilarating, So it's definitely motivated me to keep going to the gym.
Do you mind sharing more about your experience with us? Like, do you want to? It's okay, you don't have to if you don't want to, but.
I mean, I don't mind. What is it exactly you want to know?
So, like, what medication are you on? What made you start it? Who prescribed it? Was it your primary care provider? What dose are you on? Have you had any side effects? I'd love to hear about your story.
So
we need to catch up more, girl.
So So initially I had made an appointment with my PCP, but unfortunately my insurance does not cover it.
Oh,
And it sucks because there's a lot of insurance that doesn't cover for weight loss. And I'm just like, this is stupid
yeah.
because,
Mm-hmm.
you know, it helps with like cardio, vascular and all that stuff. But yeah, my insurance didn't cover it. And I think she was trying to put me on Zepbound, but there was, I think, a back order. So she couldn't even put me on that.
Mm,
So I ended up joining one of those programs. It's a compounding, they work with a compounding pharmacy. So
sure.
I'm on semaglutide. So I started at zero point 0.5 and then I went to 1 and I told them to increase it to 2 just because I was seeing like it was like slow at first. And I'm not having any side effects, so I'm tolerating it very well.
That's great.
Um,
That's awesome.
and then, you know, you hear the negative things like, oh, be careful, it has all these gastrics, negative effects, like gastroparesis and all the other negative stuff. You hear about it. I haven't had any issues, and I'm going to continue on my journey because it's been
That's
helping
great.
me. I don't think the goal is to be on it long term, but you know, just to get me where I need to be. And on top of that, what also motivated me too, when I did my lab work, my cholesterol levels were high. I was like, oh no, because that does run in my family. And then I was pre-diabetic.
Mm.
I was
Mm.
like, oh yeah, something has to give. I've been at this high weight for too long. I'm not, you know, like I just wasn't happy with myself anymore. So I'm back on a healthier me.
Love that for you.
Amazing. Yeah,
Love
thanks for
it.
sharing.
Thank you
No
so much for
problem.
sharing.
Yeah.
That's so
So
amazing.
resilience is a key theme in your podcast. How can building resilience help individuals in their weight loss journeys?
So, I mean, that's a good question. And this, I mean, it's situational for everyone. But yeah, pretty much building resilience in your weight loss journey. I mean, you need the motivation, and sometimes you're not going to have the motivation. And that's just the God honest truth. Um, so, when motivation doesn't kick in, you really need the discipline. And with discipline, it's like you have to start forming a routine. You have to start forming, you know, better habits. And they say what it takes like 21 days to build a habit. So it's like change, really. It's like you have to be open to change. And I think a lot of times people are very resistant to change. And
Mm.
that's the hardest part. I mean, you have to be motivated to, you know, change your weight for change to even be to occur. So it's like once you're open to change, once you have that positive mindset, once you're okay with failure, then I
Mhm.
think the journey will be a little bit easier. Because there's going to be times where you don't lose weight at all. There's going to be
Right.
times where it's hard to change your eating habits. I know for me, the beginning of my weight loss journey, I was exercising, but I wasn't really changing the types of food I was eating. And let me tell you, I love food. It brings me so much joy till this day.
Mhm. Oh yeah, me too.
But I found that like, okay, like maybe I could do healthier alternatives. So I think yeah, I had made an appointment with like a nutritionist to help me with the healthier alternatives. I realized after working, I don't want to spend another couple hours cooking.
Yes.
So she helped me find meals where I can use my air fryer more or like my
Love
oven
that.
more, or like quick 30-minute meals that doesn't require so much effort. So I was like, okay, maybe I just need to work around that to help me. Because I think that was like my issue. It's like, especially working in psychiatry, it's like you're so drained emotionally from
Yeah,
seeing your clients, and then you have to
I'm
come
sure.
home and still tend to your family and the house and stuff like that. So it's like, all right, what can I do to help me? So I think once she heard my needs, she was able to like assist with that. But yeah, building a resilience, it's like you just have to be positive, you have to have an open mindset, you have to be comfortable with failure. I mean, what's
Mm.
success without failure, right?
Right.
And just be consistent. I mean, you're not gonna have great days all the time, but just being able to show up for yourself.
Yeah, I like that you mentioned about failure because when you're doing a weight loss journey, like it's I think Katie said this in a previous episode, it's not a linear, just one straight road. Like it's going to be up and down because like you said, you're going to have times where you don't lose weight. But you can't let that get yourself down because it could be a variety of things. Maybe you just went on vacation, you just saw family, you went through your period, like life happens. And it's just so hard not to fixate on that scale. But just kind of expecting things may not always be on the up and up, like when you're on a weight loss journey. So I'm glad he said that.
So true. So true. And lack of weight loss does not necessarily mean that you've failed. It just means that you didn't lose weight this week. That's all it means. And it doesn't mean that you've failed at something.
And I also want to include, there is body recomposition too, where you're building muscle. And, I started Orange Theory about like back in December. And I noticed I wasn't losing weight, but I was toning up and I was building muscle. And at first I was like, I don't want to build muscle. It's adding more numbers to the scale. And you hear that a lot. You're going to be like, oh my God, like I'm getting bigger. Like the numbers are going up. I'm not losing weight, but you're definitely burning fat. So that is the thing. You could build muscle and still burn fat and look toned. So sometimes you don't need to look at the scale.
Right, exactly.
I agree.
And I find it funny when people, especially women, we're like, I don't want to bulk up. It is so hard to bulk up. Like, it is, no, you're not going to turn into Scarlett Johansson once you start working out, but it is so essential in a weight loss program. Even if the goal isn't to build muscle, but it's so important to just have enough protein and have your muscle. Because like you said, when you lose weight, I mean, you're also losing fat and muscle. We don't want that to happen.
Even if you don't want to build it, you need to at least maintain it. And also, most of us that lose weight, I feel like for many of us, we lose weight, right? And initially we're like, I'm losing weight from literally everywhere, but I don't want to lose weight from. And like initially, let's say you want to lose all your belly fat. People come in and be like, why is my butt going away and my belly fat is still there? That's how people feel in the beginning, right? And then the truth of the matter is, if you want to maintain that booty and have it looking the way you want it to look, this is where doing workouts, doing some strength training starts to come in. Because your body starts to change a lot as you lose weight.
Yep, 100%.
But okay, so next question that I had is, what or how would you recommend that individuals kind of like set and maintain healthy habits, which you kind of alluded to before when you were kind of saying that like it can take like 21 days or so to sort of like form a habit. As you sort of like now, made your own healthy habits and also probably have discussed habit forming with some of your patients, do you have anything that you'd recommend for forming a healthy habit?
Setting a schedule. For me, I have to have a schedule because there's just so much going on at the same time and I need something to keep me on track. So for me, I mean, I set a schedule and I meal prep too. And when I meal prep, I don't meal prep for the week. I'll do it for a couple of days because I find that I do get bored with the same meals and stuff like that. So I'll, set a schedule on like when I'm going to eat because there are times where I forget to eat or forget to drink. So, just having like a little reminder on my phone, like, okay, don't forget to have a fruit or eat your breakfast or drink a protein shake or drink your water, whatever. And then I'll meal prep for a couple days. And then I told you before, finding easier meals for me to cook and stuff like that. So it's like pretty much finding an individualized plan that works for you, really.
Yep.
Yeah.
That's so true.
Yeah. So Vanessa, sounds like you've incorporated some really good habits yourself. Do you have any particular advice about like some practical behavior changes that can support both mental well-being and weight loss?
For practical, I mean, everyone's different. So people have to know what their stress levels are and how to cope positively with it. So, I mean, everyone's different. Like, for example, I had a client who lost her spouse. She's not a big person, but she usually will make sure she goes on walks every evenings, and she's very mindful, with the food she eats. But since her husband passed away, it's like she doesn't want to cook for herself. She'll eat more like processed foods, a lot of the frozen foods that contains a lot of sodium. She's not taking care of her health as she once did. And I don't know if I mentioned this, but we all need a community. We all need support. So I feel like if you have that support during those tough times, it can make things a little bit easier. So here I recommended her to either join a support group or find, a therapist who she feels comfortable talking to regarding her stress. Because if you are stressed and if you don't have those positive coping skills to deal with it, you will find yourself, choosing poor food habits or poor habits and stuff like that. So it's kind of being self aware of your problems and finding that support to help you on your journey because you can't do it alone. Like, you need some sort of help. Like with me with exercise, it's like I noticed that I don't like exercising alone. I'm not as motivated, but when I do join those group classes, I just enjoyed a lot more. So it's like you really have to know what you like, what you don't like, what help you think you need, and like reaching out to ask for that help.
Mm-hmm.
Um, I mean, I could provide like positive coping skills if like, deep breathing and stuff like that, but you have to know what your problems are to even find out what techniques you need.
Absolutely. Absolutely.
Yeah, I definitely think building a village for yourself is super important because, when you're going through times like that, I imagine, it's hard for even that person, the widow, to like reach out and ask because they're so, they're going through a lot. I guess as a friend too, sometimes people are like, oh, let me know if you need anything. Like, that's so vague. No one's going to ask you.
Right. Nope.
No one's going to ask you. So just be specific. Be like, hey, I've got 3 hours. Would you like me to, I can cook you food. Second option, we could just hang out. Third, I'll do your laundry or something. Just like give options, and that'll be so much easier for people to cope. And this is true for anybody. Like, I don't know, like if you have a friend with a newborn, I'm sure it's going to be hard for them to like think of what to do. Just provide options like as a friend. And I think that would help a lot. So.
Yep. That's funny because when you say someone with a newborn, I always think of like those meal trains people do where everybody in the community like makes a meal. It's like a thing that people do and brings it to the family of the newborns those first couple weeks of birth. And I think it just reminds me of just how incredibly stressful making food can be. It's a whole thing. And when somebody does it for you, it's amazing. Yeah. But it is a total pain in the butt. Even meal prep, it's tiring. It's a pain in the butt. It's easier to just order food. So finding a way to like overcome that and figure out a way to get healthy food in, even though you don't necessarily feel like preparing the food, I think is tricky for a lot of people.
It's like preparing the food, cleaning the dishes, cleaning the kitchen.
Yeah.
It's a whole ordeal.
Yep.
Yeah. I mean, and not to say that eating out is bad. Like, I mean, if you choose good choices, like you'll be okay. I think people just tend to go for the, I want the most carbs. I want the pasta. I want this. But yeah, I feel like now restaurants and takeout places are good, at least having some good options. You could always go for like, even like Panda Express, for example, they all have the calories listed. You could do like the beef and broccoli is actually very good for you. The veggie stir fry, you can do that as well. You don't always have to get like the fried chow mein and everything. So
you're so right. And also just in general, like you're so right. But I also think, and you did a TikTok on this one time, Serena. I feel like I'm your biggest TikTok fan because I know all your TikToks. But
you're my number one fan.
On it. I am. I'm your number one fan. But I think that one of the TikToks that you did that I totally felt, because I tell my patients as well, is that you can eat, like it's not terrible to eat fast food. The deal is, and this is what I tell my patients, my dad used to say, everything in life is fine as long as it's in moderation. And I think it's so true. Like, you can have McDonald's, you just can't have it all the time, And you need to be in a headspace where you can get McDonald's and make a reasonable decision, right? So you don't feel guilty afterwards. But just because you're trying to be healthy and lose weight doesn't mean that you can't have fast food sometimes, right? It's just that you can't do it all the time and you can't do it in excess, right? In general, I always tell myself, am I going to feel guilty after eating this? If so, it's not worth it. It's not worth it. I don't want this taking up mental real estate in my head. And I think that's kind of like how it has to be, is you have to figure out like, it is okay for me to eat whatever I want. And it's okay for me to be eating fast food. I just can't eat it all the time. Right. And that's the thing that we all struggle with.
Right. That was
And
me yesterday
side
at
note, you
work.
made me want Panda Express. I don't even know why you brought that up, Serena.
I just had it this week. That's probably why.
I wasn't even think about it, and then woof.
Yeah, that was me at work because I was like, oh man, I forgot my lunch bag at home, and I'm like, oh man, I'm gonna be starving. I need something to eat, and I mean, there's some restaurants by my job, but I just didn't have the time to like leave. So I like Uber Eats, and I was like, okay, let's make a healthy option. I mean, I went for like a salad, but I mean, before I used to just order wings. Like I love wings, wings and like pastas. A lot of Caribbean food like chicken and plantains and rice and beans.
Sounds amazing.
So I was like, you know what? Let me limit. If I am gonna eat out, let me be mindful of what, the choices I make.
Good for you. I'm so proud of you because these things are so hard to do, Vanessa. And you're doing them amidst also planning a wedding and being an amazing provider. I'm so proud of you that you're taking time to like really care for yourself because it takes a lot of thought and effort. And you're doing it, and you're reaping the benefits. You're losing weight, which is amazing.
Thanks. And Katie, you are my inspiration.
Oh, stop.
Back in 2020 when you got your Peloton bike, you made me get one too. Yeah, and just your journey as well.
Thank you so much. Okay, so next question. This is a really good question, I think. So stress is often linked to weight gain, which I think Serena alluded to before. Do you have any techniques for just like managing stress in general? Like, are there any things that you will tell your patients who are like, oh my God, I'm so stressed out. I just can't take my level of stress right now. Like, what would you tell me if I was a patient and I was telling you that my stress was unbearable?
So I pretty much like to ask my patients, okay, what brings you joy? Because I think when you do little things that bring you joy, it limits or maybe distracts you from the stress that you're going through. So there's some patients that like to go for walks or play with their dogs or paint, roller skate, whatever hobby that you like to do. I'm like, I want you to make sure that you're doing these hobbies, even if it's for like 20 minutes. Just because stress is not necessarily a bad thing because there's good stress too. We have good and bad stress, and it's a normal physiological response, that we get. But I think if you start doing little things that bring you joy, it could, help limit the stress. And of course, there's like deep breathing techniques that you could do in the moment if you just needed to, recollect. There's mindfulness, there's yoga, there's just so many things that people could do. Um, I mean, Therapy, I always talk about therapy. There's medications, but I always start with the non-pharmacological stuff first.
Yeah, I totally agree. I think it's important for people to set time aside for themselves because I imagine, once you have a family, you're like not even thinking about that. And you're like, when was the last time I like picked up my guitar and like played music? Because, I think it's so important to do that. People kind of forget themselves because they're so busy with life. But like me personally, I like hiking. I like being out in nature. I love that stuff. And then I notice like I get more like grumpy and unhappy when I don't, when it's been a while since I've done that. So I have to like remind myself, okay, I gotta like do a hike because I know that'll make me feel better and less stressed. Or planning a trip or whatever. Yeah, it's just so important to plan that in for yourself. People just like ourselves, like we're providers, and so we're so used to taking care of other people, but you gotta like think of yourself and do some self-care. So I think it's really important, like you said, to maintain your hobbies.
So important.
Like self-love, I guess, just self-care, self-love, all of that's so important.
Yeah, absolutely.
Pouring back into yourself.
Yeah, you gotta fill your cup. So you're so busy filling everybody else's, but it's important. So Vanessa, mindfulness is becoming increasingly popular in both mental health and wellness circles. How can mindfulness contribute to weight loss and overall wellness?
So there's so many benefits from mindfulness. It can improve your sleep. It can reduce anxiety. It can reduce depression. It improves your memory, your immune function. So there's so many benefits to mindfulness. And then like there's some people, they don't even know what mindfulness is. I know on YouTube there's like quick 2 to 5 minute like meditation, mindfulness exercises that people could do. Um, it just helps you be still in that moment. And I find that people with like really heightened anxiety have a hard time meditating or doing these
Mm-hmm.
mindfulness exercises because their mind is always on the go. And I
Yep.
think the point of it is to be present with those thoughts. Um, and to sit with your thoughts really, and it's okay to sit with your thoughts. I think a lot of us like to run away from our thoughts and kind of distract us by doing other things, but it really kind of teaches you on how to be still and how to find peace within those chaotic times.
Do you have any advice for people that are dealing with setbacks in their weight loss journey, or just setbacks in whatever sort of wellness journey that they're having?
I mean, there's always comebacks from setbacks. You have to give yourself grace, um and be kind to yourself. It's okay, like as I mentioned before, you need to have failure to succeed. Let's talk about, I mean, Elon Musk. He's a very interesting individual. With Tesla, when he first started with this company, he wasn't profitable in the beginning. I think he had to like file bankruptcy and stuff like that. It wasn't until like 2022 where he started, I guess, reaping the benefits and being more profitable and stuff like that. There's like a lot of like celebrities who had many failures and then they became popular, later on and succeeded. I think Oprah, she had a lot of setbacks and look at her
Mm-hmm.
now.
Yeah,
Michael
she did.
Jordan, I mean, he
Yep.
had a lot of setbacks and look at him now. It's like really not giving up on yourself.
Yep.
I have a magnet on my fridge that says never, never, never give up. And then, going back to my podcast, it's like there's so many instances where I've had a lot of setbacks. And, I'm glad that I never gave up on myself because I guess I wouldn't be as far as I am now.
Yes.
There's still a lot more I want to accomplish, but just kind of setting small goals for yourself helps.
Yeah, definitely.
For sure.
Yes, speaking of, so yeah, you said you've gone through your own setbacks. As you just mentioned, you went to one school and then you didn't do well there, and then you ended up going to UPenn, and which is great. So, like, what would you recommend for someone that's going through setbacks? Like, how can they bounce back mentally, specifically in their weight loss journey?
See, it's hard because there are some people that have that intrinsic motivation where there are some people you'll find that can bounce back quicker than others. So it's a hard question to answer because everyone's different. Some people just have more motivation than others. Some people have more support than others. There's just so many factors involved. I mean, you need a community, you need someone to hold you accountable. Um, you want to make sure your mind is right. Like if you are depressed and you need therapy or medications, maybe that's the route you need to take. Um, Because for me, I've been on medications before. I've been on an antidepressant before to treat my depression and anxiety when I was really at a low point in my life. If you feel like that's what you need and you're open to it, that definitely could help. I've reached out to supportive family and friends. I did seek a therapist at some point. Um, you just really need to know what you need to help you get to that point B. It's easier said than done.
So true.
And I could like say all these things, but like it's not that easy. You have to be open to it. And sometimes it requires a lot of change. It's doing something you have never done before. So I think that's really the advice I could give. It's just being open to change and just, I guess, being a risk taker, doing something that you've never done before. And, there's always positivity on the opposite side of fear.
Right.
Oh, that's so good. That's so true.
Yeah, and I think it's just knowing when to ask for help because some people don't
Hmm.
know how to ask for help, or specifically even reaching out to,
Yeah.
say, a psychiatrist, or they might feel ashamed or embarrassed. And then it's cultural too.
Hmm.
We touched on
Right.
this in a different episode, but yeah, some cultures are just like, No, you just tough it out and deal with it. And
Mm-hmm.
it's just, as we've learned, like being here, it's like, no, it's like you can't just do that. You have to address your anxiety and your fears. And, if you're depressed, you have to address that. So I
Yeah.
think that's really important.
Yes, you don't have to sit in that, you know.
No, yeah. It's okay to not be okay. It's okay to ask for help. And I think if, more people can accept that, then it just makes things easier for them.
For those people listening who are okay, right? Who are, aren't necessarily battling any type of like mental health illness, or battling like their own level of like anxiety or depression clinically. One sort of suggestion that I have is that when I have sort of read and learned about people that have been very, very successful in life, right? Like people like Oprah, for example. One thing that some of these people have in common is that they're able to see and envision and believe in the outcome, right? So people like Elon Musk, they saw themselves as billionaires before they even,
Hmm.
before it wasn't one, maybe one day I'll be a billionaire, or I hope one day I'm a billionaire. No, 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 no. It's, I'm going to be a billionaire, right? For Oprah, it's, I'm going to be successful. I'm going to have a talk show. I'm going to win in the end. That's how my story goes. I'm going to win. Right. And so I think that this belief and understanding what the final outcome is can really help people. And one way that you can translate that into your own journey is little things, right? Like maybe you looked like really good 4 years before you got married and you want to be that again. Girl, make that your lock screen. Just to remind
Hmm.
yourself, this, not maybe I'm getting there. This is where I'm getting. This is what I'm doing. And remind yourself of all the things you've done successfully beforehand, right? You've graduated from high school. You've had many accomplishments. You've landed that job that you want. You've perhaps given birth to an entire human being and raised it and it's still alive, right? You've accomplished so many other things. And so I think falling back and remembering what your accomplishments have been and then being firm in what your final goal is can really, really help with that. Again, if there aren't other issues like what Vanessa was talking about that need to be addressed, if you are struggling with depression or anxiety, I highly recommend that you seek help because help is available. You don't need to sit in that. The help is out there. But if you're struggling through this weight loss journey and maybe this is not an issue related to that, it's just frustration about the fact that you're just been stuck at the same weight for 6 weeks, or maybe you gained weight after trying your very, very best. You worked so hard and then you're still the same weight. That happens. You're going to have periods like that. And I think that when that happens, what you have to do is kind of remember what your end goal is and give yourself that like confidence that like I'm going to reach this end goal. This is just a small hiccup, but I'm going to get there eventually.
Yeah. It's kind of woo-y, but like manifesting and thinking about that, and just I like that. I think people get into this mindset and then they go into a negative spiral because they think too much about it. Going back to the mindfulness and stuff, I think if you have that kind of like imagine the future that you want, like you kind of put yourself in the right place to get yourself there. So I totally agree with that, Katie.
Hmm. And with me, I'm a very, I would say spiritual. I'm not really that religious. I mean, I identify as Christian, but like I think my faith helped me a lot too, with meeting my goals. Because I do like to pray and stuff like that. So when there's times where I feel like, oh my God, like I feel like a failure, I am able to seek God or the universe or whatever you want to call it, just for guidance. And I think that helps me as well.
Mm,
Yeah, for
I
sure.
love that. Are there any foods that you recommend? Which I mean, I know you're not a dietitian, but like, I don't know if there's any foods from like a mental health perspective that you've noticed can help make people feel both mentally well and then also might have some physical benefits as well.
Ooh, this would be a great question for my hubby because he's like on this vegan journey right now. And I don't know if you guys know like Dr. Sebi, but like the whole alkaline vegan, like he's really like into that stuff. But definitely like your berries are good for your memories. I know we've heard like blueberries, strawberries, and all that
Mm-hmm.
stuff are really good for memory. I'm like avoiding carbs. I mean, you need your good simple carbs. But the breads, I'm kind of limiting off of the breads because I find that contributes to my weight gain. Sugars, and my dad, he was diabetic, so I really need to be careful with like my sugar intake and stuff like that. Fatty foods, definitely like the processed foods. I would avoid. So just like your whole food, so like your vegetables, your fruits, protein. I like salmon a lot. Even with salmon, you have to be careful because it contains a lot of sodium. I didn't know that. Um,
Mm.
like lean steaks and stuff like that.
Yeah,
We
definitely.
completely agree.
Yeah, we like to promote like high protein, like
Yeah, you literally
low
just
carb.
listed all the things that we
So
promote.
Yeah.
yeah. So we have a question from a listener. How can I maintain motivation throughout my weight loss journey?
Motivation. Oh my goodness. I mean, that's hard because there's gonna be days you're not motivated. It's helpful when you have like an accountability partner. So if you have someone that's like along your journey too, that's always helpful. Having that support group is helpful. That community is helpful. But the reality is you're not always gonna be motivated. This is where discipline comes in. So you're gonna have to really your discipline is gonna have to kind of take over when you're not motivated. So like in the morning, if you plan, like if you do go to the gym in the morning, knowing that okay, like I need to go to the gym, this is on my schedule, and just doing it. Because I think the more we sit and think about it, we kind of
Mm-hmm.
talk ourselves out of it and not want to go. But I think really like understanding your why and your purpose could help with that motivation and discipline. Like if you know, like, okay, I mean, for me, it's like, okay, I'm planning a wedding. That's kind of like a short-term goal. Like, okay, I want to lose this amount of weight. But long term, it's like, my dad died from pancreatic cancer. He had diabetes. There's cholesterol in my family. I don't want to go along that path. So I think that kind of motivates me to continue the journey. So it's like really understanding your why and your purpose behind it definitely can help.
Yeah, I agree so much. And I think it's those days when you have no motivation. I think that's so important because not everyone's always going to be like, okay, let's get to the gym. It's you really got to dig and dig to
Mm-hmm.
find that because you could easily fall off. And then you're
Mm-hmm.
like, well, I didn't go to the gym yesterday, so I guess I'm not going today. And then becomes weeks, becomes however long. And then you're like, oh gosh, I have to really get back into it. It's like this yo-yo effect. So it's so
Mm-hmm.
important to like you said create habits and just do it.
That
Mm-hmm.
discipline piece is so true and so powerful because that is exactly where discipline comes in. Is you're not always going to
Mm-hmm.
feel like it. Sometimes you just have to do it. At the end of the day, it's your body. You're responsible for it. You're going to be the one who
Mm-hmm.
faces the consequences if you don't take care of your body. Sometimes you just have to force yourself to do it.
Mm-hmm. It's like my mom. So my mom, she's obese and she's short. She's like 5'2", and like she is at the point where she has osteoarthritis in both knees, and like her weight, contributed to that. And now we're like talking about like surgery, and the doctor, the
Mm.
orthopedic surgeon, is kind of like, you need to lose, this amount of weight before we could even do surgery. So it's like, mom, like you have to do something about it. And I mean, she has like her mental health issues and stuff like that, but she's never been
Right.
the person to make great, food choices and stuff like that. But I think now, and then I guess my wedding too is coming up. So now she's like really
Sure is.
taking key into like changing her eating habits. And I think I'm kind of motivating her too, because it's like, mom, what did you eat today? Because she'll ask me, oh, what did you eat for lunch? And like we kind of share, our meals.
Aw,
That's
I
so
love
cute.
that.
I
You're in it
love that.
together. Mhm.
Super, super cute. What is the most important advice you would give to somebody who's struggling with both their mental health and weight loss? Right? If somebody was just like, give me one piece of advice, what would it be?
It's okay to not be okay, and don't be afraid to seek help. We all deal with problems. We all have problems.
Mm-hmm.
And yeah, it's okay to reach out and ask for help. You're not in this alone. There's people that could, support you.
Yeah, for sure. I totally agree. Awesome. So Vanessa, where can our listeners find more about your work and
Yes.
tune into your podcast?
Well, I have a podcast on all platforms. It's called Find Your Resilience, that I started back in, I think, 2022. So yeah, I'm on Apple, I'm on Spotify, I'm on all platforms. So you can find me there. I did take a little hiatus because I am planning a wedding, but I'll be
Mhm.
returning next year. I do have
Yay.
some candidates that are willing to do some episodes with me. But yeah, I just share different walks of life and their insight on resiliency.
Awesome.
I
And do
love
you have
that.
any social media or website that we can find you as well?
Yes, on Instagram, it's Find Your Resilience, the podcast.
Very cool.
Thank you so much, friend, for coming and hanging out with us. This was amazing.
Thank you for having me. This was
Of
great.
course.
I love this. I haven't been on a podcast or done podcasting in a while, and I'm like, oh, I missed this. I need to get back to it.
Oh, you're an expert, girl. That was so
Yes.
fun. So we'd love to
Yes.
have you back.
Oh, thank you,
Of
Zarina
course.
and Katie.
Anytime you want to come hang out with us again, we're always happy to have you. This is an open invitation.
This was great.
Well, you have a wonderful rest of the day and a great weekend.
You too. Thank you so much.
Of
Take
course.
care.
Bye-bye.
Bye.
If you've enjoyed today's episode, please take a moment to subscribe to our podcast, give us a rating, and share with your family and friends who might find it helpful.
And remember, we love hearing from our listeners. Connect with us on our social media channels or shoot us an email with your thoughts, questions, or suggestions for future topics. Don't forget to check out our website, www.thewayinandpeace.com, and to follow us on Instagram at thewayinandpeace.
If you need one-on-one help with your weight loss or wellness journey, book a private consultation with us. The A-List Clinic can be reached at www.thealistclinic.com or on Instagram and TikTok at The A-List Clinic.
And my clinic, Lifefire Weight and Wellness, can be reached at www.lifefireweight.com or on Instagram and TikTok at lifefireweight.
Thanks again for tuning into the Wayne Podcast with your hosts, Katie and Zarina. Until next time, take care and be well.
The information in this podcast is for general information only. It is not intended as medical advice and should not be relied upon as a substitute for medical consultation with a qualified medical provider familiar with your medical needs.